Hey, this is Andrea Kane, and I'm here with you again at HIT 292 Reimbursement Systems, and we are on week 12 still. This is lecture video number 4 of 7. We are now talking about ambulatory surgery centers and their payment system. If you're following along in your book, this is the bottom of page 169, and we are talking about ambulatory surgery centers, as I said. So, these are outpatient centers that are specifically set up and designated as an ASC. They may be owned by a hospital, but their reimbursement system is totally separate and different. ASCs have to be Medicare certified. They only provide designated surgical services to Medicare beneficiaries under Part B, among other patients, but they have to be a separate entity, have its own national identifier under Medicare, maintain its own licensure, accreditation, governance, professional supervision, administrative functions, clinical services, record-keeping, financial, and accounting systems. They must have the sole purpose of delivering services in connection with surgical procedures that do not require inpatient hospitalization. If you remember, in our last video when we were talking about OPPS, we talked about the fact that there is a list of inpatient-only procedures that cannot be performed and reimbursed under OPPS. It's the same thing with ambulatory surgery centers. Those inpatient-only procedures cannot be performed at an ASC. And then, of course, they have to meet all the conditions and requirements set forth in the Social Security Act. So what is the payment system for ASCs? Well, the Medicare payment is in full. CMS pays 80%, the beneficiary 20%. Make sure you know that. The reimbursement is for facility services. The physicians who provide and perform the procedures are reimbursed under RBVS. So make sure you notice this. The ASC payment system reimbursement is for the facility resources, not the physicians who perform the procedures. They get reimbursed under RBRVS. The payment rate is when wage index adjusted. Labor portion is 50%. And the wage index values are the same as the IPPS and OPPS for the year under review. Not all procedures are allowed in the ASC setting. Some have to be performed in the hospital setting instead of the ASC setting. We talked about those inpatient-only procedures. And they use HCPCS Level 1 and Level 2 codes to report services in the ASC setting. We are now on page 170. Procedures that are excluded from ASC payment systems are that inpatient-only list, packaged procedures under OPPS, CPT unlisted surgical procedures, procedures that are not reimbursed under OPPS, procedures that generally result in severe blood loss, procedures that require major or prolonged invasion of body cavities, procedures that directly involve major blood vessels, procedures that are emergent or life-threatening in nature, or procedures that commonly require systemic thrombolytic therapy. Systemic thrombolytic therapy. Those are all no-nos for the ASC setting. They will not be paid under that payment system, and they should not be performed there. The ASCPS uses a modified OPPS APC system because not all the procedures allowed in the hospital outpatient setting are allowed in the ASC setting. That's why the APCs are modified. The payment rate for ASCs is 58% of the OPPS rate because the ASC setting has less overhead than a hospital would, and that's why there's that 58% payment rate, which is a reduction from a hospital OPPS rate. And it shows you here that in 2018, the momentarily stopped, sorry. The conversion factor, yes, is 45.58. You could probably go out to the Federal Register and find out what the conversion factor is for 2020, if you were so inclined. Separately payable services. These are services that are outside the surgical APC rate. The separately paid services have their own APC groups, and that includes radiology, brachytherapy, drugs and biologicals, implantable devices with OPPS pass-through status, corneal tissue acquisition, and non-imaging diagnostic tests. So these are separately payable services. And this is on page 171 in your book in case you are wanting to read more about that. ASC provisions. There are 3 that we're going to talk about here, at least on this slide. That includes device-intensive procedures, where the device offset percentage is greater than 40% of the median cost under OPPS. And so the device cost is a significant amount of the cost of providing the service. The rate is modified for those procedures. If they're doing multiple and bilateral procedures, the highest gets 100%, and then all the remaining are 50%. That's when you're doing multiple. If it's bilateral, it's 150% of the payment rate. And you have to make sure you use that modifier to indicate bilateral. Interrupted procedures. These are modifiers 73, 74, and 52. 73 is when the surgery is discontinued before the anesthesia is administered, and you get a 50% payment rate. Modifier 74 is surgery is discontinued after anesthesia has been administered. That's a 100% payment rate. Modifier 52 is the procedure does not require anesthesia and is reduced or discontinued at the physician's discretion. That's a 50% payment rate. And the interrupted procedures, you'll notice, are identical from OPPS to ASC. So the payment determination is simple, ha ha ha, as if any of these are ever really simple. Wage index is adjusted by the conversion factor, and you multiply the adjusted conversion factor by the APC relative weight and apply provisions if applicable. And this is at the bottom of page 172, figure 7.21, where you can see that the ASC conversion factor is really the 50% labor-related portion adjusted for area wages and the hospital wage index that goes into that number. Then you add to it the 50% non-labor related portion. The next set of steps after you've adjusted for geographic factors is adjusting for complexity of services. And that's where your conversion factor that has been adjusted for geographic factors is multiplied against the APC relative weight to give you your payment. And that is it for ASC. I will be back with the next video, which will be number 5 out of 7, where we're talking about end-stage renal disease payments.